Hello everyone, welcome to today's Health Talk. This video is especially important for older adults and for family members who take care of them. Today, we are going to discuss 7 very common foods that can secretly triple the risk of having a stroke. Many of these foods are eaten daily, but doctors and stroke specialists are now warning that too much of them can damage blood vessels, raise blood pressure, and lead directly to brain attacks. In this program, I will explain clearly what these 7 foods are, why they are dangerous for seniors, how they increase the chance of stroke, and what safer alternatives you can choose instead. At the end, I will also give you practical advice about medicine-food interactions and the key warning signs of stroke that you should never ignore. Let us begin. Before naming the foods, it is important to understand why diet plays such a big role in stroke risk. Most strokes happen for 2 main reasons. The first is high blood pressure, which weakens and damages the arteries inside the brain. The second is atherosclerosis, which is the buildup of cholesterol and plaque inside blood vessels. Both of these problems are made worse by poor diet. If an elderly person eats meals high in salt, sugar, or unhealthy fats, their blood vessels become stiff, their blood pressure rises, and clots are more likely to form. If a clot travels to the brain, or if a blood vessel bursts, a stroke happens. That is why doctors always warn seniors to pay careful attention to what they eat every single day. Now let's move to the first food. The first food on the danger list is processed meats. This includes bacon, ham, sausages, hot dogs, and packaged deli meats. Why is this dangerous? Processed meats are extremely high in sodium and in preservatives called nitrates. Too much sodium pushes blood pressure higher and higher. According to the American Heart Association, a high-salt diet is one of the leading causes of stroke among older adults. Nitrates also damage the inner lining of blood vessels, which makes clots form more easily. For seniors who may already have hypertension or diabetes, eating processed meat every day can double or even triple the risk of stroke. So what can we do instead? Try replacing processed meats with fresh, lean proteins. For example, grilled chicken breast, baked fish, or even beans and lentils. These foods give the body high-quality protein without all the salt and preservatives. If you absolutely want to enjoy ham or bacon, keep it as an occasional treat, not a daily breakfast habit. The second dangerous food, or in this case a drink, is soda and other sugar-sweetened beverages. Many people, especially in hot weather, love to drink soft drinks, sweet iced tea, or packaged fruit juices. But these drinks contain massive amounts of sugar. What does sugar do? When we drink too much sugar, blood sugar levels rise quickly. Over time, this leads to insulin resistance, weight gain, and type 2 diabetes. Diabetes itself is one of the strongest risk factors for stroke. In fact, medical studies have shown that older adults who drink sugary beverages every day have a significantly higher risk of ischemic stroke compared to those who avoid them. Another problem is that sugary drinks give calories without nutrition. They cause the body to store fat, especially around the waist, and this belly fat produces inflammatory chemicals that damage arteries. What should seniors drink instead? The safest and healthiest option is plain water. If plain water feels boring, try adding slices of lemon, cucumber, or fresh herbs like mint. Unsweetened green tea is another excellent choice because it provides antioxidants that help protect blood vessels. We have now covered the first 2 foods, processed meats and sugary drinks. Both are extremely common and both can quietly raise the chance of stroke in older adults. In the next section, we will continue with food number 3, food number 4, And food number 5, each with its own risks and healthier alternatives. The third food that greatly increases stroke risk is fried food and most fast food meals. Examples include fried chicken, French fries, donuts, deep-fried snacks, and even some street foods that are very popular. Why are they dangerous? Fried foods contain very high levels of unhealthy fats, especially trans fats and saturated fats. When oil is reused many times in fast food restaurants, it becomes oxidized, producing harmful compounds that damage the lining of blood vessels. These fats increase bad cholesterol, also known as LDL cholesterol, while lowering good cholesterol, HDL. The result is clogged arteries, higher blood pressure, and an environment where blood clots are more likely to form. For seniors whose blood vessels are already weaker, this is like adding fuel to the fire. Studies have shown that people who regularly eat fried foods more than 4 times a week have a much higher chance of both heart disease and stroke. What are the healthier alternatives? Instead of frying, try baking, grilling, or steaming. For example, chicken can be oven-baked with herbs, potatoes can be roasted with olive oil instead of fried, and snacks can be air-popped popcorn or roasted chickpeas. These methods preserve flavor while avoiding dangerous oils. The fourth group is salty snacks and highly pickled foods. This includes chips, crackers, salted nuts, instant noodles, pickled vegetables, and soy sauce-heavy dishes. Salt is one of the strongest drivers of high blood pressure. Medical guidelines recommend no more than 1,500 to 2,000 milligrams of sodium per day for older adults. Yet just 1 pack of instant noodles or 1 small bag of chips can contain more than half of that daily limit. Pickled foods, though traditional and delicious, are often prepared with large amounts of salt and vinegar. Eating them every day can slowly raise blood pressure. In seniors, where blood vessels are already stiff, even a small increase in pressure can cause bleeding in the brain. Doctors who treat stroke patients often find that elderly people who suffer hemorrhagic strokes had a long history of eating salty, pickled foods daily. What are the alternatives? If you enjoy pickled flavors, try making low-salt versions at home with vinegar and natural herbs. When craving a snack, choose fresh fruit slices, unsalted nuts, or plain yogurt. These foods satisfy hunger but do not overload the body with sodium. The fifth food is red meat, especially when consumed in large amounts. Beef, pork, and lamb are traditional sources of protein, but eating too much can be harmful for seniors. Red meat contains high levels of saturated fat and cholesterol. Over time, this contributes to the buildup of plaque in the arteries, a condition known as atherosclerosis. Once arteries in the brain become narrow and stiff, the risk of ischemic stroke rises sharply. Research has shown that people who eat red meat every day, especially processed or fatty cuts, are more likely to suffer from stroke than those who eat red meat only once or twice a week. Another problem is that cooking methods such as grilling at high temperatures can create harmful compounds called heterocyclic amines, which further damage blood vessels. What are the healthier alternatives? Try limiting red meat to small portions only a few times a week. Replace it with fish, especially fatty fish like salmon, mackerel, or sardines, which provide omega-3 fatty acids. Omega-3 helps reduce inflammation and protects arteries. Plant-based proteins such as beans, lentils, and tofu are excellent choices for seniors. We have now covered 5 dangerous foods: processed meats, sugary drinks, fried and fast foods, salty snacks and pickled foods, and large amounts of red meat. Each of these contributes to stroke risk in different but equally harmful ways. In the final part, we will explore the last 2 foods, number 6 and number 7, and then talk about medication-food interactions, warning signs of stroke, and lifestyle habits that can protect seniors for many years to come. The sixth food group that raises stroke risk is refined carbohydrates and foods with hidden added sugar. This includes white bread, pastries, cakes, cookies, and many packaged breakfast cereals. Why are these dangerous? These foods are quickly broken down into sugar in the body. This sudden spike in blood sugar forces the pancreas to release large amounts of insulin. Over many years, this constant stress leads to insulin resistance and type 2 diabetes. Diabetes is one of the strongest predictors of stroke. Another problem is that refined carbs and sugary desserts add empty calories without nutrition. They promote obesity, especially abdominal fat, which produces inflammatory chemicals that damage blood vessels. This inflammation creates the perfect condition for blood clots. Healthier alternatives include whole grains such as brown rice, whole wheat bread, oatmeal, and quinoa. For dessert, try fresh fruit or a small piece of dark chocolate with at least 70% cocoa, which contains antioxidants that support vascular health. The seventh and final item is alcohol, especially when consumed in large amounts. Many older adults enjoy a glass of beer, wine, or liquor in the evening, but excessive drinking can be extremely dangerous. Alcohol raises blood pressure, causes irregular heartbeat, and damages the liver. Heavy drinking also makes blood more likely to clot, which can trigger an ischemic stroke. On the other hand, alcohol thins the blood in unpredictable ways, which may cause bleeding strokes in vulnerable people. For seniors who are already on medications like aspirin or blood thinners, alcohol can create dangerous interactions, increasing the chance of sudden bleeding in the brain. Doctors generally recommend that older adults either avoid alcohol completely or keep it to a very small amount, no more than 1 drink per day, and not every day. Safer alternatives include sparkling water with lemon, non-alcoholic beer, or herbal teas that promote relaxation without health risks. Important note: for seniors, food is not just food. Many are taking daily medications for blood pressure, diabetes, or heart disease. Certain foods can interfere with these medicines. For example, grapefruit juice can block enzymes in the liver, changing how drugs are absorbed. Foods very high in vitamin K, like spinach or kale, can reduce the effect of warfarin, a common blood thinner. Too much salt can reduce the effect of blood pressure medications. That is why it is critical for seniors to always ask their doctor or pharmacist about possible food-drug interactions. A harmless meal can sometimes make a medicine stop working, which increases stroke risk without anyone realizing it. Recognizing the warning signs of stroke. Even with a careful diet, strokes can still happen. That is why it is essential to recognize the early warning signs. Doctors teach the simple word FAST. F stands for face. One side of the face suddenly droops. A stands for arms. One arm feels weak or drifts downward. S stands for speech. The person suddenly cannot speak clearly. T stands for time. Call emergency services immediately. Every minute counts. Other signs can include sudden dizziness, loss of vision in one or both eyes, sudden confusion, or a very severe headache with no clear cause. If any of these symptoms appear, do not wait. Call for medical help right away. Fast treatment can save the brain. We have now completed the list of 7 foods that dramatically raise the risk of stroke in older adults. 1. Processed meats. 2. Sugary drinks. 3. Fried and fast foods. 4. Salty snacks and pickled foods. 5. Red meat in large amounts. 6. Refined carbohydrates and sugary desserts. 7. Excessive alcohol. Each of these foods can damage blood vessels, raise blood pressure, or interact badly with medicines. For seniors, avoiding them or limiting them can mean the difference between healthy aging and a devastating stroke. The good news is that it is never too late to change. By choosing fresh fruits, vegetables, whole grains, lean proteins, and plenty of water, seniors can protect their arteries, lower blood pressure, and enjoy life with energy and independence. So remember, every bite matters. By making wise food choices today, you protect your brain for tomorrow. Thank you for watching, and please share this information with family and friends. You may save a life.